Did you know that about 1 in 3 pregnant women experience hemorrhoids? In today's video, we'll go through hemorrhoids in pregnancy. We'll go through the causes, the symptoms, the treatments, the safe medications to use, and at the end, we'll go through lifestyle and prevention tips. Let's get into it. First, let's understand what hemorrhoids are and why they occur in pregnancy. Hemorrhoids are swollen veins located in the lower anus and the rectal area. They are more common in the second and third trimester as the baby starts to get bigger. There are 4 main reasons we get hemorrhoids in pregnancy. Number 1, there's increased pressure on the veins from the growing uterus. Number 2, hormonal changes during pregnancy. Pregnancy hormones make the walls of the veins relax, making them more prone to swelling. Number 3, changes in blood flow. During pregnancy, the volume of blood we have in our body increases on average by about 45%. This increases the pressure on the veins. Number 4, constipation. Up to 40% of women experience constipation in pregnancy, and this is a risk factor for hemorrhoids. So who's more at risk? There are certain women who are more likely to experience constipation during pregnancy. These include older pregnant women. If you've had multiple pregnancies, and if you've had hemorrhoids before, you're more likely to get hemorrhoids during pregnancy. So what are the symptoms of hemorrhoids? There are 2 different types of hemorrhoids, and the symptoms differ depending on the different types of hemorrhoids you've got. First, we've got the internal hemorrhoids, which as the name suggests, starts internally. They are located inside the rectum and can cause bleeding, but don't usually cause any pain. These hemorrhoids can sometimes come outside of the body through the anal opening. This is sometimes called a prolapsed hemorrhoid. The second type of hemorrhoid is the external hemorrhoids. These are usually found as hard lumps on the outside of the anus. They don't usually cause bleeding but can be very painful. Hemorrhoids in pregnancy does usually go away a few days after you give birth. Here are some home remedies which can help to ease the symptoms. Home remedy number 1 is the sitz bath. This is basically when you soak your bottom area in a warm, shallow bath. You can purchase specific small bath containers, or you can just use a bathtub. Soak your bottom area for 10 to 30 minutes each time in warm water and repeat this multiple times a day. This can help to increase the circulation and reduce swelling and pain. Number 2, use an ice pack or a cold compress. Apply this for 5 to 10 minutes at a time. It's a good idea to alternate throughout the day between a sitz bath and a cold compress. Number 3, use a hemorrhoid cushion. A hemorrhoid cushion is a donut-shaped cushion. This can take the pressure off the hemorrhoids when you're in a sitting position. Number 4, treat any underlying constipation by increasing fibre and water. You can watch this video here on how to treat constipation in pregnancy. Number 5, if you've got a protruding hemorrhoid, you may be able to pop it back in by yourself with a finger. This can help to reduce the discomfort. You can use a finger glove and a water-based lubricant to make it easier. And the last tip is to use soft, unscented wipes instead of toilet paper. This can help to reduce the irritation to the area. Now, if you've tried these home remedies and they still haven't worked, it may be time to try some over-the-counter creams or suppositories. The main ingredients you'll find are a corticosteroid such as hydrocortisone. This will help to reduce the inflammation and relieve the itchiness. A local anaesthetic such as benzocaine or lidocaine. This will help to numb the area. An astringent such as witch hazel or zinc oxide. Astringents can help to shrink the size of the hemorrhoid and reduce bleeding. An antiseptic and an anti-itch such as benzoate and peribalsam. These can help to prevent infection and get rid of the itchiness. Most of the over-the-counter creams and suppositories are considered safe in pregnancy. If the hemorrhoids are quite painful, you can also take some oral paracetamol. Make sure you don't take any non-steroidal anti-inflammatories such as ibuprofen or diclofenac in pregnancy. Now, if you've had hemorrhoids before, then you know just how uncomfortable they can be. Here are some tips to help prevent hemorrhoids. This is especially important when you're pregnant, as you're much more prone to getting hemorrhoids. 1, eat plenty of fibre. You can get fibre from foods such as fruits, vegetables, whole grains and legumes. Aim for 30 to 35 grams of fibre a day. Ideally, you should space out the fibre throughout the day to avoid any bloating or stomach upset. Tip number 2, drink plenty of fluids. During pregnancy, it's really important to keep your fluid intake up. Aim for 8 to 12 glasses of water a day. Number 3, keep active. Sometimes it's really hard to stay active during pregnancy, especially if you're getting morning sickness, tiredness, and if you're in your last trimester. It's still important to try and stay active so your bowel movements can stay regular. Tip number 4, answer when nature calls. When you feel the urge to go to the toilet, make sure you go. Delaying can lead to constipation, more straining, and more chance of hemorrhoids occurring. Tip number 5, avoid straining. Straining can exacerbate hemorrhoids. Tip number 6, don't sit or stand for too long, as this can put pressure on the rectal veins. Number 7, do your Kegel exercises. Kegel exercises can help to strengthen the pelvic floor and improve circulation to the rectal areas. Number 8, Sleep on your left-hand side. This takes pressure off your rectal veins and is the optimal sleeping position to improve blood flow to the baby. If you see any blood in the stools or when you wipe with toilet paper, if over-the-counter treatments don't work and pain persists, if you take any medications or have any medical conditions, then speak to your healthcare professional. And that comes to the end of our video. Thanks for watching, and I hope it's been helpful. If you have any questions or if you have any experience with hemorrhoids in pregnancy, then please comment below. If you want to see more videos like this, then please subscribe, and we'll see you next time. Bye.